Dr. Pescatore. Next, from the United States, Dr. Kenner. He got the national certificate for acupuncture in Japan and got the doctoral degree at National University. Currently, he is now at the Acupuncture Integrative Medicine College, Berkeley. His talk is about monitoring changes in blood parameters in cancer patients taking an immune modulator.
Thank you. Well, I'm very pleased to have this opportunity, and many thanks to all the ladies and gentlemen at Daiwa Pharmaceutical. I was a clinician for 35 years, and I still see a few patients, I should call them clients, 3 or 4 days a month. And now I do mostly writing, consulting, and some research. And I think I'd like to begin by saying that I feel like the real problem with finding a cure for cancer is the preoccupation that the cancer industry, the medical profession, has on tumor reduction. The disease that generates these tumors is what needs to be treated, not getting rid of the tumors themselves. And the cost of tumor reduction is very high because it may cost the immune system, it may cost the use of the bone marrow. So what I'm saying is that conventional medicine is not really treating cancer. The worst aspect of the situation is that there have been actual cancer treatments that are safe and effective that have been ignored by the mainstream. Now, here are a few. There's Max Gerson, who is a medical doctor from Germany back in the 20s. He was working in prestigious hospitals, and he was using natural therapy, mostly built around diet, for treating all kinds of diseases. And he had to leave when the Nazis took power, so in the 40s and 50s he was in America, in upstate New York, treating mostly, by this time, cancer patients. William Donald Kelly was not an MD, he was actually a dentist. And he had pancreatic cancer, cured himself completely using Gerson's program, and went on for the next 3 or 4 decades helping other people cure themselves of cancer. Now, Dr. Nicholas Gonzalez wanted to do a PhD under his supervisor from Sloan Kettering Cancer Institute, and he wanted to do his doctoral program by discrediting William Kelly and exposing him as a fraud. But he went down and found that, in his words, oh my God, this is real. He found at least 50 cases that were completely airtight of diagnosis, treatment, and complete remission of cancer with all the medical records. He was allowed to interview patients years later. And so Dr. Gonzalez developed his whole practice based on Kelly's treatment, and he began to adapt it in certain ways on his own. There are also literally hundreds of airtight case histories of the Gerson program that have been collected with all the medical records, medical images, blood tests, everything. They wouldn't collect it if you were missing one blood test. They wouldn't archive your case. Bjorn Nordström's a Swedish doctor who developed a method of tumor reduction by using an electric current. And he wrote a book called Bioelectric Currents back in the 1970s. William Coley, I think it was this morning, it was Dr. Han Gredinger who mentioned a German doctor who was doing the same thing, but William Coley was using streptococcus, a serum derived from streptococcus, which would completely devour tumors, even if they were all through the body. And as Dr. Pescatore pointed out, there were, it would also generate a high fever, so hyperthermia may have been a part of the effect. And then William F. Koch, he was working with quinones and developed treatments for cancer and leukemias and chronic viral infections back in the 30s and 40s. But all of these doctors, none of them were punished, none of them lost their reputation, but they were simply ignored. Koch went to Brazil, where the Brazilian government offered him a free laboratory and a lifetime income. The great humanitarian and Nobel Prize winner Albert Schweitzer said Max Gerson is the greatest medical mind of this age, and he was actually Gerson's patient. And Gerson treated Schweitzer's wife for pulmonary tuberculosis. Bjorn Nordenstrom is on the Nobel Prize Committee for Medicine and Physiology. And William Coley is called the father of immunology. And his treatment, called Coley's toxins, were actually bought by Park Davis Pharmaceutical Company back in 1930 and have hardly ever been heard from again. So there are a lot of successful methodologies that have been ignored. Immune boosting therapies, and that's part of what we're talking about today. Ozone, oxidative therapies, electromagnetic therapies, as far back as the 1930s, using high-frequency currents to dissolve tumors, and reported in the peer-reviewed medical literature of those days. Hyperthermia is in widespread use in Europe, a little bit in the US. Insulin potentiation therapy is used so that it's possible to reduce quantities of chemotherapy drugs, or for that matter, anything that's being used for treatment. And then there are several intravenous botanical therapies that have been used for tumor reduction. Now, my complaint is that most research is histological. It's looking at through microscopes at different types of cancer cells and classifying, or it's working with cell lines in petri dishes. And what we really need is a global model that's scientific of cancer physiology. There's very little research on metastasis, less than 1%. So what is important is whole body global factors. And in my book, The Whole Body Workbook for Cancer, I explain these in more detail. But oxidative stress is extremely important, because when there's oxidation, there's an increased viscosity of fluids. And this has a damaging effect on the cellular environment, because nutrients can't get to the cells, waste products can't leave the cells, and gradually, for certain populations of cells, the microenvironment becomes anaerobic. And so without any oxygen, when the integrity of the cell is broken down, the DNA from that cell goes into an anaerobic environment where it makes God knows what type of new life. And this new life is not organized in any significant way, but we can see this in our clinical work, because a lot of the tumor markers are actually embryonic antigens, like CAE. CEA is carcinoembryogenic antigen. AFP, alpha fetoprotein. These are found in embryos, and they're also found in cancer patients and used sometimes for diagnosis and more frequently for monitoring. Inflammation can be a cause of cancer. Back in the 19th century, cancer was called the wound that doesn't heal. It creates kind of a vicious circle, because the byproducts of the inflammatory process promote cancer development and metastasis, and then the byproducts of cancer development also promote the inflammation, so it becomes a downward spiral. And pharmaceutical companies for years have been looking for things that will suppress NF-kappa beta, which is an intracellular inflammatory factor. Glycation, uncontrolled reaction of sugars. Now, the greatest enemy of health, whether it's chronic pain, cardiovascular disease, cancer, and of course diabetes, is sugar addiction. Nothing else really comes close. And it's important to remember that cancer cells live exclusively on glucose. They live on blood sugar. They can't adapt to living on fats, which is one rationale for using the ketogenic diet with cancer patients, because humans can adapt to producing energy from oils. And if we do it exclusively from fats and oils, then the cancer cells are deprived of sugar and they begin to starve. Immunosenescence. Immunosenescence means in a healthy person, the NK cells, for example, are scavengers. We've seen again and again how they can destroy cancer cells by attaching to them and injecting the granules and blowing them up. And we know that they'll also attack any abnormal cell, virus-infected cells, but their normal function is just to promote cell turnover. And so the NK cells help reduce congestion, because normal cells at the end of their life have to be broken down and removed from the cellular environment, and the natural killer cells do that. So this is why BioBran is important, because there are these 4 factors that are global factors of cancer development: oxidative stress, inflammation, glycation, and poor immunity. And BioBran helps with all 4 of these, because it's an antioxidant, an anti-inflammatory, a normal glycemia, and immune boosting. So, of course, we can't trust published research, and I'm in full concurrence with Dr. Pak on that. But there are indications that BioBran is an antioxidant and an anti-inflammatory. This is an interesting idea about this micro-inflammation, because this can also help explain why curcumin works so synergistically with the BioBran, because if you can really put out this inflammation that may not even be noticeable. It may be people with low body temperature. Most cancer patients are hypothyroid to some extent. And this kind of smoldering inflammation that increases oxidation and oxidative stress going on is an important factor to control. Another countermeasure is correcting glycation. And there are indications that there are blood sugar regulating benefits from using BioBran. And then low immunity. Of course, we've seen a lot about that today, and this is an important factor, because if there is any kind of scientific model for the global factors that affect chronic disease and cancer, it would be immunology. And especially if we start hyphenating it with psycho, neuro, endocrine immunology, then we're starting to get a scientific model of something that can model the activity of the entire body. It's also important to remember that NK cells are extremely sensitive to stress and to trauma. And I did a literature search on this and found literally dozens of studies that show that NK cell activity, not the quantity of NK cells, but their activity goes down from, you name it, from hurricanes, from tornadoes, from divorce, from self-criticism. Every stressful factor you can imagine, they found that the NK cell activity goes down, to the extent that we might even consider lowered NK cell activity as a marker for post-traumatic stress disorder. Now, this is one reason that I like to recommend BioBran for anyone that gets surgery, because surgery is a trauma, and even though it's a controlled trauma, and it may not be a psychologically stressful trauma, but it is a trauma, and the immune system goes down, and it's important to protect people after surgery from catching the common cold and having it go quickly into pneumonia. And from Professor Endo's lecture this morning, there may be another factor, because if dendritic cells have acetylcholine receptors on them, that could be another connection between stress and immunity. So in addition to providing countermeasures to these 4 factors that promote cancer development, BioBran also has anti-cancer activity. So this is above and beyond the call of duty. I think if there are enough studies, we can say that it probably has some benefit. So here are some of the effects of BioBran on the immune system. Upregulation of dendritic cell activity, improving the CD4-CD8 balance, inhibiting immunosuppressive cytokines, and it's really an immunomodulator. And as it was pointed out earlier, it can stimulate the immune system or it can suppress it. For example, tumor necrosis factor alpha. Is an inflammatory marker. If someone has too much of it, for example, in rheumatoid arthritis, BioBran seems to bring it down. But if you need to have more tumor necrosis factor alpha, it will stimulate it. And the same with interferon and with the interleukins. So a few cases, these cases, many of these patients had more elaborate blood work, but I focused on just the complete blood count because this is what they came for. Now this patient has been a patient for a long time and he's a friend. He's come mostly for treating pain, but when he developed oral cancer and prostate cancer, he decided to do completely conventional therapy. My book, The Whole Body Workbook for Cancer, is complementary medicine because it's written for people who are going to get conventional therapy. But most of the people who have come to me want alternative treatment. They are people who want no chemotherapy, no radiation, and want to avoid surgery if possible. Well, this was not the case with him. He wanted to do conventional treatment all the way, but his platelets were low, and his doctors were concerned because the platelet count had been getting lower, and they were concerned about hemorrhage. And they were planning to possibly do surgery and didn't want to do it with a platelet count low. So I gave him a dose of BioBran, 1 capsule twice a day. These were 500 milligram capsules, and there were no significant changes until I increased the dose to 2 capsules twice a day. And then if you look at the results, the platelet count came up very remarkably. And then 6 months later, it was up in the normal range, and it stayed there. And now this patient, like the other patients I'm going to show you, is not getting chemotherapy now. He's not getting any treatment. He is considered to be stabilized. And that's the other point I want to make about the BioBran, because with people who are either in remission or who have finished their therapy, the BioBran seems to stabilize them. Now, I don't know how long this will last. You know, he may have a recurrence later on, but for about a year now, he's been very stable, and he's been seeing his oncologist, and there have been no significant threatening changes. This patient is one of the people who absolutely refused any kind of conventional treatment, and so she went to Germany to a natural cancer clinic there, and in her case, it wasn't the platelets, it was the white blood cell count was low. Only marginally low, but it was a matter of concern to her. So we began the BioBran 2 capsules twice a day, and within 3 weeks, the white blood cells had come up into the normal range. And once again, they stayed there. Here's a female patient, 75, triple-negative breast cancer with liver metastases, and treated with Taxotere, Taxol, Adriamycin, and came to me already at stage 4, already still doing chemotherapy, but she was anemic, and her platelets were high. And she asked me, do I have anything that will help? And so I said, well, let's do BioBran. I started her out on 2 capsules twice a day. I thought about starting her even higher. And less than a month later, the platelets had come down, but the erythrocytes, the red blood cell count was still low. But by April 12th, which is, this is only, about 3 months after beginning the BioBran, the red blood cell count came up into the normal range. And then here is a 71-year-old man with brain cancer in the frontal lobe. He'd had surgery. He had had 2 courses of chemotherapy. They didn't recommend radiation for his case. And he began BioBran capsules, 2 capsules twice a day. His lymphocytes were low. His monocytes were high. And after BioBran 2 capsules twice a day, the lymphocytes were still low, but the monocytes came into the normal range. But this is 6 months after taking the BioBran. He was still stable, and he's still stable now. And that's, I think, the message I want to leave you with, that I think that, we know that it has normalizing effects on the immune system. It can raise parameters that are low to higher levels. It can suppress levels that are too high, but it can have effect on just the ordinary blood parameters. And I think the most important thing is that keeping people on it for several months after their treatment can consolidate any benefits from conventional treatment and stabilize the patient for weeks and months, if not years to come. So thank you for your attention.